Hello, everyone, and welcome to Research Updates with Leslyn. I'm Gail Straker. I'm the Community Manager for Lipedema Simplified, and I'm here today with Leslyn Keith. She is our Director of Research and President of the Board for Lipedema Project. And this is going to be a little different today. As you can tell, we are about 30 minutes later than we usually go, simply because Leslyn is not at home. Leslyn is at one of the Gordon Research Conferences on the lymphatics in Ventura, California, and I think she has a lot to talk to us about today. So when you log in, say hey, tell us where you're coming from, tell us who you are, and we're just going to go ahead and get started. We're really excited to be able to do this together today. Hi, Leslyn.
Hi. And normally I'm reviewing a paper, a paper that's been some kind of research or information that's good for people with lipedema, or if you have a loved one who has lipedema. And this time, my regularly scheduled Thursday for doing the research updates, I happen to be at a research conference. And there's a lot of updates here. There's a lot of wonderful presentations and a lot of just people, researchers and clinicians all talking to each other. So Gail and I thought we'd just have a chat about it to let everybody know what's going on at this conference.
Yeah, and one of the things that I had a question about is, what is a Gordon Research Conference?
Mm-hmm. Yeah, that's a great question. And this is a conference idea that was started actually in the 30s by Dr. Gordon. I think he was a biochemist, and he wanted to get together other researchers and people in academia and just talk about what is the newest things that are happening in that particular field. And well, it worked so good for what they started out with in biochemistry. They thought they would expand onto all kinds of other different types of discovery and stuff, mostly having to do with the human body and medicine and stuff like that. So lymphatics, as with usual, they were kind of late into being part of the Gordon conferences, because this Gordon Conference is going since 1931. That's almost 100 years that they've been doing these, and they're around the world. They bring experts from everywhere together to talk about that particular field of study. Lymphatics started 20 years ago. That's when they started doing conferences that focus on lymphatics. And so, and apparently it's always been in Ventura, California. And so this is the first time I've been able to attend, although I've known about it for maybe at least a half a dozen years. And just this year I was able to come. So I'm really excited to be here. And there are researchers from really around the world. It is just an amazing group of people that are all talking about the lymphatics. And there's some really exciting new stuff to do with studies of lymphatics.
Right. But you're not just there as an attendee, are you?
Well, I have a poster that I'm presenting, and it is our award-winning poster that Siobhan did when she went to Potsdam, Germany for the Lipedema World Congress meeting that was held in October in Germany. And so it's about ketogenic diet for lipedema, and it's specifically talking about what are the mechanisms, why do we think it works? And that's is really suited to this conference, because the Gordon Research Conferences like to really focus on the molecular level of things, and what is the process, and how can we stimulate good things, and how can we interrupt bad things, but all looking at the cellular level. And so I thought this was particularly good for this conference, and since it's award-winning, I thought, okay, let's present it here. And it's been very well accepted. I was presented on Tuesday that they had a poster session, and I was there for that 2 hours talking to people about the use of ketogenic diet for lipedema.
And that's pretty amazing, because with we hear all the time that, diet and exercise doesn't have an impact on lipedema. And we're discovering that a lot of our community members find that super low carb or the ketogenic way of eating has made a difference. It has had an impact on their lipedema. And so when we know it has in our lives. And now we have a poster that explains the possibility of why it works on a molecular structure
Mhm.
level. So that's really exciting. What other kinds of things? First of all, do you know who's there that we would recognize names of?
Well, I think a big one that people would recognize is Dr. Stanley Roxon. And actually, 20 years ago, when they had the first one, he was the chair of the meeting. And he was here, and he actually instituted something that is different for Gordon Research Conferences. He started having a patient panel, and this started in 2016. Because prior to that, patients and your lay person and stuff, they were not invited. They were not to come to these conferences. You had to apply to. You still apply to attend, and and so Dr. Roxon thought that this is pretty important because a lot of the research that's being discussed is really it's animal research. It's happening in a petri dish. There's not a lot of translation into people. And so he thought we need to have that. This is the people that we are trying to help by all this research and the study we're doing. So in 2016, he started with the patient panel. I have to say, as a clinician, that was probably one of the highlights of the conference for me. And so that happened yesterday. And he usually has people coming in, but starting with COVID, we started doing it more by Zoom. And so we had 4 different patients. One was a child, and 3 adults. And they talked about their lives and what's happening with them with their lymphatic disorder. And the people in the audience were able to, talk with them and ask them questions and stuff. So that's probably one of the highlights of the conferences for me.
Yeah, patient panels. I mean, we all have our stories, right?
Yes, yes.
And by going from being, like you said, animal studies, petri dish studies, right, to actually finding how it impacts us as human beings and in our own daily lives, it's a huge difference. And
Mm-hmm.
it lets us be seen. Those patient panels let us be seen
Mm-hmm.
and heard.
Yes.
And so that's marvelous. So Leslyn, what are some other highlights besides the patient panels and getting to rub shoulders with Dr. Roxon?
So, yeah, I'm just looking at my notes to look at some of those other highlights. Besides rubbing shoulders with Dr. Roxon, which was he volunteered to come speak for our local certified lymphedema therapist group as well, and so that was wonderful to do that with him. But another highlight for me has been being able to meet a lot of the people that I've been reading their papers, and some of the people I've been reading their papers for like a decade following what they're doing. And one of those is Natasha Harvey in Australia. And as you can imagine, it's not often that I would cross paths with someone in Australia. Now that we do Zoom so much, maybe it'd be more likely. But I've been reading a lot of her papers, and she had done a lot of research about the interaction between adipose tissue and lymphatics. Pretty important for both lymphedema and lipedema. And she also has done a lot with genetics and what is the impact of various genes on lipid or on lymphatic functioning. And so I've been reading a lot of her papers over time, so I got to meet her, and that was wonderful. And then also lately, my focus has been a little bit diverted quite a bit because of what's been going on with her and because of Kelly Bell is, what's happening with the lymphatics of the trunk and the lymphatics that go to the organs. And there actually was quite a bit of discussion on organ-specific lymphatics and what happens when those lymphatics are not working, what happens to organ function and stuff like that. that's been happening here a lot. And so I really feel that's another way that this really applies to our lipedema community, because I wonder how much in general are the lymphatics in lipedema, especially in the trunk, are they slow moving? Are they sluggish? And that is contributing, as Natasha Harvey has shown, lymph stasis causes a lot of fat buildup. And so if we are not moving through our trunk well, we're backing up into organs and impairing the organ function, but we're also leaving a lot of fluid in the arms and legs. And that could be causing a lot of fat tissue expansion. So I think that all ties together. And so I've really appreciated what the direction of the research has been, really looking at organs and lymphatics and the functioning of the lymphatics in the trunk.
So when we look at that, I've been thinking about the same thing. Like, do we all do those of us with lipedema, do we have something central? Maybe it's the extreme that Catherine is dealing with and Kelly is dealing with. But is there, that there could just be that little bit of a lymphatic issue? And my question is have they talked at all about massage? So like so often when we have our manual lymph drainage, we focus on the limbs, right?
Mm-hmm.
Now, would that be
Right.
something that we really need to not only focus on the limbs, but do maybe overall whole body lymphatic
Or just focus for a while on the trunk,
in the
because
trunk?
if this not moving, it doesn't matter how much you push on it out here, it's
Right.
not going to go anywhere. And
Right.
so it almost, Kelly has talked about how when he really works this area, his arms and legs will reduce without him even touching them. And so, of course, I want to, if I have a really enlarged limb, I want to work on that too. But our focus really needs to be central and focusing on that trunk, if we really want to have a good impact on the periphery.
Yeah, that's kind of a curious, it's kind of like we can take care of the limbs by taking care of the center.
Yes,
that's
exactly,
awesome.
exactly. And you don't think about that, but it's kind of, as a lymphedema therapist, this is long standing that, the first day the patient comes in to have their manual lymph drainage, that massage, and they say, I got a swelling in my hand, and I start working up here, they're confused. I mean, but we, as a lymphedema therapist, we know we have to start centrally. And so
Yeah.
I think as a therapist, we can really accept that. And someone who's been getting treatment for decades, they understand that. All I'm saying now is let's just do more of it. Let's do more focus right here.
Right. I do want to say, we can hear a lot of people, and Christine says, those researchers sound like a wild bunch.
I know. So they have broken for lunch, and so there's a lot more. I'm kind of sitting in the bar actually, and most of them are away from here, but maybe you can hear some of the people talking nearby. So yeah, and let me tell you, when we were all there's a certain room where we had all the posters in. And you're talking, 100 or so people in there with not a super large room, but, had all those posters in there, and they're all passionate and talking about their poster. It was really loud.
I'm sure it was. So if I wanted to know more about it, where do I go? What do I do? I mean, is there
So about the conference?
Yeah.
So, and we have a link there's a link for just the Gordon conferences in general, but there's hundreds of them. And so if you want to find the one that's related to, if you go to that main website that I gave you, Gail, you can put in search for a particular field, and you can say, like if you really want to know more about kidneys, or you want to know more about heart or something like that, you could put that in. I also gave you the link specifically for this one, the lymphatics. So if that's what you want to look at, you can follow that link. It'll give the whole program is listed on there. If you scroll down the page, you can see who the various researchers who are presenting. I know we have some of our group that are really get into those research papers. I'm thinking specifically of Kathy Plavkin. I mean, she's always sending me papers. So someone like Kathy is going to go through that program and see a bunch of names you recognize because you've seen these people on papers. And there are a couple of the people on that list that have just published papers that Kathy has just sent me. And so now I'm getting their, they're talking about that research they've been doing, in person. I'm not just reading the paper. I'm getting to meet and talk to that researcher. It's pretty neat.
That's incredible. So Leslyn, so I posted that link in there, and then it's if they want to go just to the Gordon Research Conferences, it's grc.org, right?
Right. It's GRC is what they call it. So it's grc.org. With that would get you to a listing of all of the Gordon conferences, and they are held around the world.
Okay, so I put the main website in there as well.
Yes,
but the one
yes.
the one that I posted is for this 2024 conference.
Yes.
So
it's been here for 20 years in Ventura, but now I think it's going to go to Italy next time. It's held every 2 years, and it might be going to Italy next time. So I guess I got to get my Italian vacation planned.
Like, get your passport. Make sure your passport's in.
Right. I think it's going to be in 2026. My passport's good till 2027. So
okay. So you're set. You're set for that. And so there was one other thing that we're having here with Lipedema Simplified, and we have in about 12 minutes, as soon as Leslyn goes and has her break, we have a pain management webinar. Let me grab that real quick so you can see what it's called.
So it's happening at the top of the hour right now, 4 p.m. Eastern. And so I we'll sign off a little bit early so Gail can get to that. But this is super important. It's talking about exploring pain management with nutrition. And this is happening. It's a free webinar happening at 4 p.m. top of the hour. So go to that link. Even if you're not available, if you got to sign off after I'm done here, still register because you can get that replay. This is going to be very good. So I know that Siobhan Huggins is going to be talking. Who else is talking?
So Siobhan Huggins is going to be presenting for the nutrition aspect, and nutrition always sometimes includes supplements and things like that. And so Brian Hayward is going to do a short presentation on how CBD can be incorporated in our pain management routines that we follow and our protocol. Yeah. So, and Fiona's here. Hi from New Zealand. I just see Fee's here. So I would like to welcome everybody here before we close off. I'm so glad that you were all here. We had Tammy from Texas, Victoria's from Buffalo, Maria's from Florida, Sherry is from Florida, and she says, thank you for all you do, Leslyn. Kim is here from Texas. It's cute. It says Gigi's for Halos, and I thought it said Gigi's for Halos because that's what I go by is Gigi's. Kathy's here from New Jersey. Aileen Navarro is here from Puerto Rico.
Yes.
And let's see.
Tamara also from Texas.
Yep. And then we have someone else from Michigan, and then Fiona's here from New Zealand, and it's always good to see where everybody is here from. We do know that we have a global presence, and so it always makes us happy to know just how far out in the world that people are listening to us from. So,
Yeah.
Leslyn, how do you want to wrap this up? Because this is usually your broadcast, and I'm treating it like it's my broadcast.
Well, I'll probably do also a flash briefing about this same topic and maybe go into a little bit more in depth about what some of the presentations were about. So if you haven't already signed up to get those flash briefings, that is lipedema-simplified.org/flash. And you can see when you go there, you'll see an archive of all of those flash briefings. But you can also sign up so that every time a new one comes out, you can get that recording. And so I'll do a recording of more information about this conference. And so be sure to tune in for those flash briefings. Also, check out our blog, lipedema-simplified/blog, I think is what it is. And so Gail contributes to that blog kind of every other week from me. We have a new blog post that comes out every Thursday. And so I do some research updates also on that blog, alternating with Gail, talking about less nerdy stuff, probably.
Okay, so Gail does the less nerdy stuff,
Yes,
right?
you do. Yes.
I'm like, my stuff is more woo-woo, I think.
No, it's more, it's looking at the social and the emotional and all those other sides of lipedema. So check out those two things, the blog and the flash briefing. And then one other thing I'm going to just push on because of this webinar that's coming up on the nutritional management of pain is that check out our Heart to Heart coming up in April. And this is April 12 to 14, and it's going to be keto and beyond. How do you manage your lipedema with nutrition, and how can we tweak it to make it personal for you and work for your individual situation? So be sure to check out that link as well and join us. We're going to have some fabulous speakers.
I'm going to drop that link. I'm going to drop that link as well into the comments because that way you can get a hold of it. You can just click on it and register. But really make sure that you register for today's webinar that is going to be in 7 minutes. Even if you can't make it, that's the way you get the replays is by registering. And so make sure that you get that registered. I just threw in a whole bunch of links. And it was the one that says that ends with.
Yeah, it says April 12 to 14 Heart to Heart. And then we have the one for the, I know you put it, don't you have one that says exploring pain management with nutrition? It should be one. Yeah.
Yeah,
it ends with the word webinar.
Yep, ends with the word webinar. There you go. We have, it says live link to pain management seminar from the Englishman. Yes, I'm going to post that one more time. So it's the last one that's up. So
because it's what's happening in 6 minutes. So that's the most important one.
That is the most important one because it's happening. As soon as I find it again, it's happening now. So so get on, and it's with Siobhan Huggins. You are not going to want to miss it. She is phenomenal.
Yes.
So let me put that one more time in our.
There it is.
And so there it is. Free webinar, Managing Pain with Nutrition, March 7th. That's today. Siobhan Huggins. That's the link. Register for it and come right in.
Yes.
We're going to be there. So,
okay.
Leslyn,
thank you so much for joining me today, Gail.
Oh, you're welcome. Sometimes I think this is where I really, truly belong. It's right here. Right here. So Have a wonderful rest of your conference, Leslyn.
Thank you.
And we will see you. I'll see you tomorrow.
Yes.
Okay.
Bye,
Everybody.
everybody.
Okay.